Thank you for the guidance and advice. Thank you for the introduction. Welcome to people who are here today visiting. Okay, this presentation is an overview of a method that we thought would be useful to take a look at in terms of whether it would have value and application in the province of Ontario. So the presentation is going to be a little bit about how did we do this, and not so much about and how would we use this, if you see where I'm going. So although the methodology that I'm going to describe is not complicated in either a statistical or well, particularly in a statistical sense, I am going to walk you through the steps of a relatively complicated journey to get to the outcome, which is, if I could sort of do the punchline, a way of characterizing different economic sectors in Ontario in terms of the exposure to working conditions that are reasonably of concern because they might be responsible for work-related injury and illness. Two people I just want to acknowledge as we set off on this presentation. Jacob Etches, one of the people in this research group, was responsible for a significant amount of untangling of some fairly complicated administrative data resources. And Imelda Wong, who's been here at the Institute for the past 2 years as a postdoc. Imelda, are you here? Here you are. Imelda helped us obtain some of the fundamentally important information here from a Statistics Canada resource called the Labour Force Survey. Okay, so by way of background, there's sort of two background pieces I'd like to share with you. The first is the guidance that the Ministry of Labour received in 2010 from the Expert Advisory Panel. Tony Dean panel, it's sometimes described as. Tony Dean, 9 colleagues on the advisory panel who brought forward a series of, I think if I remember, 56 recommendations for reform and strengthening of the occupational health and safety system in Ontario. Recommendation number 6 placed an emphasis on improving the way in which we measure the performance of occupational health and safety protection, both at the workplace and at the level of the economic sector in Ontario. And the panel talked about the idea of indicators of performance in terms of worker health protection that had predictive validity, was the language the report used. So a measure with predictive validity has value because it allows us to anticipate what the future is going to look like in terms of either an individual firm or an economic sector. And the panel used the phrase leading indicators to describe this class of measures. Okay? So that's one piece of background. The second piece of background comes out of the field of occupational epidemiology. For quite a long time, probably for more than 50 years, those of us in the discipline of epidemiology who are interested in understanding the relationship between an exposure that occurs at work and the risk of or the subsequent development of disease or the risk of injury have faced a challenge, which is that having high-quality information on which occupations are encountering which exposures, whether they're physical demands or chemical exposures, is not well monitored in any economy. So, for example, we do not know today in Ontario, how many people are at work and working at heights that would be a concern if they fell. So, how many people of the 6 million people in the Ontario labor force at work today are working at heights? We don't know. How many people in the past year in Ontario were working in environments where exposure to diesel fumes was sufficiently prevalent that we might be concerned? We don't know. Okay? So the challenge that occupational epidemiology has responded to has been to develop a methodology that's used many different ways of attributing the characteristics observed in often a small number of workers to all of the people in the same occupation. You with me? That idea? And so sometimes these are called job exposure matrix. But the idea is that the exposure information obtained from one source, whether it's a careful measurement in an individual workplace, or sometimes it's by the consensus of a group of experts about what the exposure is in a particular occupation. That information is imputed, if you're following me with that word, to all the people in that occupation, and is used as a measure of an exposure estimate that then can be assessed relative to progression, development of disease or injury. It's been around for a long time. The methodologies are different, but they often correlate quite well with self-reported measures. So let me give you an example. Okay. So an example would be an occupation that has high physical strength demands would be many of the construction occupations, right? Where lifting weights or managing loads of more than 20 kilograms is not unusual. If you ask people who work in those occupations what the typical maximum load is that they may have to lift in a day, you will hear them say, well, 20 kilograms or more is not unusual. That's what I mean by the correlation to self-reported work exposures is often quite good. So I'm going to give you two examples of these attributed exposure methods. The first one is from the Canadian resource, Carex Canada. How many people in the room are familiar with this resource? Okay, many of us. It's a really valuable thing that has been built under the leadership of researchers and a fairly significant commitment on the part of provincial regulatory authorities across this country. Paul Demers is really the lead on this. It's based out of UBC. There's a terrific website. But the idea of Carex is to estimate the number of Canadians exposed to substances that have an established association with the risk of cancer, both exposures in workplaces but also in community settings. 44 specific carcinogens are in the database, and the estimates of exposure are available for industries, for occupations, and for men and women. And where does this come from? This graphic from the Carex website just draws out the observation that the sources of information on exposure may come from research studies, they may come from administrative information maintained by regulators, they may come from other countries where we're imputing the exposure information from a similar economy. So, for example, the United States to the Canadian economy. And there's a specific resource here called the Canadian Work Exposure Database, which I won't describe. The primary sources lead us to estimates of the proportion of workers exposed using information from the census, which is really the only source of information in this country for fine-grained information on how many people work in specific occupations. Multiply a proportion times the census count of the number of people, and we get an estimate of prevalence. So Carex is a very important piece of work that is built on these methods of imputing to occupations or industries an estimate of what the exposure is. Here's a second example. This is a United States resource called ONET. It's actually not an occupational exposure resource in its initial purpose. ONET is a description of about 800 occupations in the U.S. economy. And the description contains information on what the what the educational requirements are for the occupation, what the skill levels are, the nature of the work that a person does. And it also contains, helpfully, some information on working conditions that most of us in the room would recognize as being relevant for thinking about health conditions arising from those exposures. So here's an example. There's a questionnaire that's administered, I'll describe that in a moment, that collects information on, self-reported information on exposure to ergonomic hazards, outdoor work, whether you operate a motor vehicle, the self-reported understanding of exposure to contaminants and the use of hazardous equipment and conditions. So ONET's resource in the United States actually collects this information directly from a sample of about 28,000 people who are in those occupations. And from the averages, let's say dentists. So of those 28,000 people, there's probably 4 dentists. The average score for those 4 dentists is then imputed to all the people who are dentists. You with me? Okay. So here's an example of, in a sense, validating ONET, the occupational, or the occupational exposure information in ONET. Occupational noise exposure, that comes from ONET. That's the estimated exposure. The health outcome of concern is hearing loss. Now, ONET is just an administrative database that describes occupations. It has no information in it about the health outcomes of those occupations. This particular study used the NHANES survey, the National Health, I can't remember what it stands for, but the U.S. NHANES survey is a sample, representative sample of the U.S. population. It includes biological specimens, and it includes an audiometric test. It's a sample, if I remember correctly, of about 6,000 U.S. citizens who had a hearing test as a part of NHANES. That's the hearing function source of information. For every NHANES participant, recording information on their occupation allows an imputation of what their noise exposure was in their longest job. Okay? You with me? So the information in this table, there are 3 groups here where the noise exposure at work is relatively low, and they're quintiles, so they're 20% of the sample. There are 2 groups where the noise exposure is higher, quintile 4 and 5, and then the hearing function measures show us that people exposed at work to noise, the 40% of people exposed to the highest noise exposure at work, and this is imputed, right, have a greater prevalence of hearing loss, and in the case of the highest quintile, basically twice the prevalence, the incidence, the prevalence of hearing loss. And noise notch is a particular characteristic of noise-induced hearing loss, which is the decay of function in a set of frequencies that have been observed over time to be related to exposure to noise. And again, the noise notch measure shows that in the 40% of respondents at the highest noise exposure had the greatest prevalence of noise notch. So this is an example of validating the exposure information by linking it to another source of information that allows us to observe health and function. Okay. So what did we do? So we thought it would be useful to look at the possibility of drawing hazard exposure measures from a Statistics Canada survey source and translating that information obtained for occupations into an estimate of what the exposure burden was in 56 economic sectors. Okay? And then we thought it would be useful as well to look at the degree to which these economic sector hazard exposure measures were correlated with the burden of work-related injury and illness. And here we're using workers' compensation statistics, claim statistics. Okay. So I'm now going to start into the description of the methods. It's not going to be complicated in terms of statistics, but I am going to walk you through some of the methodologic fences we had to get over. Okay, so to start off, there are 6 million people in the Ontario economy working. We assigned each labor force participant to one of 56 economic sectors based on information from the labor force survey. This is a summary, and then I'm going to go through this in more detail. We obtained 13 measures of working conditions from a resource that originated with the federal Department of Employment and HRSDC, Human Resource, is that what the R stands for?
Yes.
Human Resource Skills Development Canada publishes a handbook on a regular interval, but from that handbook are information on 13 working conditions that we think are relevant for thinking about the health and the safety of workers. And then we turn to the information on the occupational composition of 56 economic sectors to translate the exposure information that's available for occupations into an estimate of the prevalence of exposure in economic sectors. Okay, I'll walk you through this. Now I'm going to take you into a little bit of a tour through how we classify industry and occupation. So occupation in Canada is organized by the National Statistics Agency and by other authorities that have responsibilities for monitoring the labor force using something called the National Occupational Classification. The important idea here is that the structure of this classification scheme is nested. So to guide you through that, there are 26 major groups. Inside each major group, there's some minor groups. Inside each minor group, there's some unit groups. So here's a little sketch of what that looks like. So a major group titled Professional Occupations in Health contains those 5 minor groups. Physicians, dentists, and veterinarians are members of one minor group, but they are individually in unit groups, those 3 health professions. Okay? Just so I am. Okay. So how many, just now I'm going to do a little interaction. In the province of Ontario, how many physicians, dentists, and veterinarians do you think there are? Imelda, you know the answer, so you can. Leon says 50,000. Okay, how about nurse supervisors and registered nurses? That's all nurses. 100,000. Not bad. Okay. So the answer to those questions, right here, physicians, dentists, and veterinarians, about 25,000. That's close, Leon. And nurse supervisors, registered nurses, 90,000. Very good. Very good, Leon. And if you wanted to know about all these other minor group occupation counts, this information is available from the Labor Force Survey. What this slide is doing is adding in some information about the incidence of work-related injury and illness as it's portrayed through the registration and acceptance of compensation claims. So these are the years 2007, 8, 9, 10, 11. And this is the incident rate of compensation claims per 1,000 people in this occupation. The observation here would be, here's this major group called clerical occupations. You'd think, it's pretty benign. It's just pushing paper, or nowadays electronically filing things. There is a minor group in there called mail and message distribution occupations, where the incident rate of work-related injury and illness is high. Okay, fair enough. Here's another view of that same, the importance of the classification scheme. In the professional occupations in health, the incident rate of work-related injury and illness is perhaps not concerning until you get a look at Nurses. Sheila.
This would be lost time injuries?
Jacob, it's both, right? We can't remember. We'll get back to you. Okay. So, Sheila, thank you. Sheila just asked the question whether the incident rate here is total claims or lost time claims, and you're making the observation that these are, by definition, lost time claims because occupation isn't recorded on no lost time claims, correct? Okay. Okay. Is there anything particularly complicated about this? No. The Workplace Safety and Insurance Board classifies occupation, I'm looking for confirmation, using the same scheme that I'm describing here, the National Occupational Classification. Okay. Now I'm going to switch over and talk a bit about the classification of industry, which is in the province of Ontario, and in fact in all Canadian provinces, it gets a little bit complicated because we use two different schemes to classify industry, depending on which administrative function is at play. The North American standard is the North American Industry Classification System. It too is nested like occupations. So there are 20 sectors, 102 subsectors, 423 industry groups, and they're nested. So within each sector classification, there are subsectors. Within each subsector, there's industry. Okay. Working with colleagues in the Ministry of Labor, we created an amalgam of subsectors, the 102 subsectors, to represent 56 economic sectors in Ontario. There's a bit of an expert consensus process on what amount of consolidation would be acceptable and still be valuable. When the Ministry of Labor conducts its responsibilities in terms of enforcing the law under its responsibility, it classifies employers to the North American Industry Classification System. When the WSIB classifies employers for the purposes of insurance premium rate setting, they use a different scheme called the Standard Industrial Classification, I think. I'm looking at Emil, thank you, which is historic. It predates the North American Industry Classification System. And these two classification schemes were never designed to actually perfectly align with each other. So there's some discordance in the comparison of these two ways of classifying industry. A few other notes just as I go into the next couple of slides. Not all economic sectors in Ontario are under the jurisdiction of the Ministry of Labor. So, for example, give me an example of a sector that's under federal jurisdiction for the protection of the health of workers. Airline transportation? Banks? I don't think so. Oh, yes, financial services, right, Leon? Banks are federal? Okay, so that's just some examples. About 10% of the Ontario labor force is under the jurisdiction of the Federal Labor Code, and therefore federal labor inspection and enforcement. In addition, not all sectors in Ontario have the same requirement for WSIB insurance coverage. Turns out that the financial sector it's excluded from the requirement to insure their workers with the WSIB. Other sectors have there are other examples of this. About 30% of the labor force in Ontario is in an employment relationship that does not obligate their employer to have WSIB coverage. Okay? This is going to be relevant as we go through the next couple of slides. Okay. Oops. There. All right, so here's a sample. This is in the classification of employment by economic sector. Here's an example of just 12 sectors. They're just sort of a random sample. And what I'd like you to draw your eye to the first two columns where we're comparing the estimate of the total labor force as you would observe if you obtained information from Statistics Canada, and then an estimate that we had to work our way through what proportion of the total labor force is actually insured for coverage by the Workers' Compensation Authority in Ontario. And we needed to do this because one of the ways in which we wanted to look at the validity of a hazard exposure index was the degree to which it predicted the incidence of work-related injury in Ontario. So here's an example. The finance and insurance industry employs about 350,000 people in Ontario. Many of them just down the street here, Bay Street, but not all of them, by any means. Because it's a sector that is largely excluded from the requirement to obtain insurance coverage with the WSIB, only about 20,000 of those people would have a compensation claim. You with me? And the incidence of work-related injury and illness viewed through that lens is very low for that sector. It's about 9 per 1,000 full-time equivalents. In contrast, a sector which historically has been very important for the economy in Ontario, the transportation equipment manufacturing sector, that includes Bombardier's facility at Downsview that builds airplanes and auto assembly facilities. About 150,000 people directly in that sector, and the second column indicates that that's a very high coverage sector in terms of the proportion of people in the sector who are insured by the WSIB. So, and the third item here I'll just draw your eye to that's yellow highlighted is residential building construction. 100,000 people approximately working in that sector, and by our estimates, about 30,000 of them are in an employment relationship that would provide them coverage with the WSIB. Jake?
Yeah, just on that point, those are 2011 data, so it predates the expansion of coverage.
Okay. And what Jacob's referring to is that in 2013, the WSIB adjusted their insurance practices such that self-employed individuals in this industry who were practicing as independent contractors, is that the right language? Were required to obtain coverage from the WSIB. The estimate is that the coverage now in that sector is probably up around 60 to 70,000 people. Okay.
Can you tell us what the bottom other public administration we can't see on the screen? Okay,
Right. So Monique has asked the question at the very bottom of the screen. Other public administration, the incident rate is about 70. Okay, you're welcome. Okay, so now I'm finally getting to the fun part. You've heard me talk about 13 occupational hazards. Here from the HRSDC handbook, on the left-hand column, are the 13 working conditions that we wanted to evaluate for their relevance in depicting the risk of work-related injury and illness in Ontario. The column headed Ontario Labour Force is just reporting what the prevalence is of exposure when we go through the exercise of estimating how many occupations in Ontario require heavy strength and how many people in Ontario are currently employed in those occupations. And I'll illustrate this in a moment. The right-hand column is providing to you the information on what the minimum and maximum value of these working condition exposures are across the 56 economic sectors in Ontario. So let's take, way down at the bottom, I apologize, some of you can't see it, the estimate about exposure to noise that increases the risk of hearing loss in the Ontario economy from the period approximately 1995 to 2000, where these estimates were originally established. About 16% of the labor force working in environments where the exposure to noise would be concerning around the maintenance of hearing function. Interestingly as well, the range, if you think across economic sectors, is from a low of 5% to a high of almost 75%. So this is in a sense the root or the source information that we commence to work with. Let's see what else is relevant. Do people work in an unregulated indoor environment? The idea there is that the temperature of the indoor environment is not being controlled. That's the idea of unregulated indoor environment. I think the rest are probably pretty self-explanatory. Okay. And these estimates, I just remind you, in the HRSDC handbook, were not established by interviewing a representative sample of workers. They were established by an expert consensus process. So people who were familiar with working conditions in the Canadian economy participated in a process of voting, essentially, occupations, matching occupations to exposures. So the next step in the process involved the journey of counting up the number of people in the 56 economic sectors by their respective occupational characteristics or occupational titles, because it's at the level of occupation that we have information on these 13 exposure characteristics that we're interested in. So here's an example of one one economic sector. Heavy and civil engineering, about 40,000 people working in this sector. And here are the top 10 occupations. So a very significant number of people who are in the occupation of helping and laboring, a lot of heavy equipment operators, supervisors, truck drivers, construction managers, senior managers. So a heterogeneous group of occupations by both job task, skill, and, of course, compensation. Okay. So here's the portrait of that same sector when we translate the information on the 13 occupational hazard exposures through the prevalence of the variety of occupations in that sector to end up with an estimate of the sector-specific exposure prevalence. Have I described this clearly enough so people understand where we are? Wally, you're kind of frowning.
I always
Oh, yeah, okay. You're very funny. You do not. There, now you're smiling. So, did I describe it clearly enough so people understand how we got here? Okay. You have a question, anybody? All right. So this table is comparing the people working in the heavy construction sector to the Ontario labor force. Okay. So the requirement for heavy strength, which is the lifting of 20 kilograms or more, about 20% of the workforce in the heavy construction sector would potentially be exposed to this, versus about 5% in the Ontario labor force broadly. Requiring bending, stooping, kneeling, crouching, it's a little bit higher. An outdoor environment, 55% relative to 23%. Noise exposure, 67% relative to about 17%. Probably you're saying, for those of you familiar at all with the construction sector, this is probably not an inaccurate portrait of the kinds of exposures that would accumulate or be prevalent in this sector. So these portraits then have been assembled for each of 56 economic sectors. And I'll show you now the way in which we looked at two different methods for, in a sense, consolidating the information across the 13 characteristics to come up with a score, a single value for each sector. Not that a single value is necessarily better than the individual scores at the level of the specific hazards, but we wanted to have a look to see what that would look like. So two methods, I'll just walk you through them briefly. The second method, moderately sophisticated in terms of its analytic approach. The first method, actually quite simple, which I'll describe in a second. So in the first method, we simply summed the frequency of an occupation having an indicator that exposure was a concern in this occupation. So for example, let's say an occupation had, on the basis of expert assessment, was rated as having a high strength requirement and frequently bending, stooping, kneeling, but none of the other hazards. That occupation would carry a value of 2 out of 13. Right? That's how simple this is. The score then for each occupation ranges from 1 to 17. The reason it's 17 and not 13 is that we thought it would be useful to make more use of the strength requirement measure than just simply a 0-1 measure. So each unit group in the occupational classification has a hazard exposure score. We then, within each economic sector, just summed all these unit group scores at the level of the occupation, and we ended up with values that ranged on this composite score from 100 to 750. 100 is financial insurance, farms is 750. So this is a portrait then of the 56 economic sectors. The dots are not conveying any information on the magnitude of employment. They're just 56 equal-sized dots. On the vertical axis is a measure of the incidence of work-related injury and illness. It's the total compensation claim rate, so it's lost time and no lost time claims. And there is a relationship here between, on the horizontal axis, this composite index, this single score ranging from 100 to just a little south of 800. And we've brought in information here on 4 sectors. Non-residential construction is high exposure, high hazard exposure, and relatively high incident rate. Trade contracting, similarly. Long-term care, and here's the observation, relatively high incidence rate. It's the same sort of level of incidence as the 2 construction sectors, but the hazard exposure score looks low, doesn't it? Right? Okay. And down in the bottom left-hand corner, an economic sector, professional, technical, scientific services, which we think of as low hazard, and it has a low incidence of work-related injury and illness. For those of you in the room who do this for a living, what do you think the correlation coefficient is for this? 0.7 from Sheila. Maybe a little lower. Christina, what do you think? 0.5, 0.6. Okay, it's 0.76. Okay, is that good, Sheila?
Depends what you want to do with the data.
That's good, thank you. All right, so the second method is more elaborate. This slide takes you through it. I'm just going to summarize it by saying that we took a look at the utility of using a method called factor analysis to determine if there would be value in weighting the 13 hazard characteristics according to the degree to which, on the basis of the factor analysis, those characteristics lined up or participated in something called the factor structure. the simple observation here is that about all of the measures loaded on the first factor, and the factor was responsible for about 32% of the variance. So we proceeded forward to use the factor score. There's a series, the first factor score, there's a series of descriptive information here. The outcome was the same in terms of our intent. We wanted to have a single score for each sector that was based on the information from the 13 hazard exposure measures available for occupations. So here's the story for the factor exposure index, and it's the same presentation. On the vertical axis is the total compensation rate. The 56 sectors are plotted. Low exposure on the left, high exposure on the right. And we've, again, renamed the, provided names for 4 of the sector dots on this graphic. Essentially the same portrait. The rank ordering changes a little tiny bit, but the fundamental finding is that both methods essentially produce the same result, which is that high hazard sector scores, that's to the right, are associated with a high incidence of workers' compensation claims. Does anybody have a sense of whether the correlation for this plot is better than the other one?
Pretty close, a little bit tighter, this one also.
Yeah, good. So Sheila's making the observation that this one is a little bit tighter. In other words, that if you imagine a diagonal that's going through all those, a linear line, a line that's going through all those data points, the distance away from that line in this graphic seems to be smaller than in the previous one. And I think that's correct. So the correlation coefficient here is 0.8. Okay. So here's kind of a summary. I've just mentioned these 2 correlation coefficients. The composite hazard, which is the simple exposure index of 0.76 correlation. The factor exposure index, 0.8. And the 2 indexes are very strongly correlated, and they look like that. Okay. A couple of observations here. Long-term care, on the basis of the comparison in the 2 indexes, long-term care looks like on the simple index it should be scored higher. In other words, it should have a higher score, and that's consistent with, whoops, let me go back here. That's consistent with the pattern on both of the indexes, that long-term care has the employment in long-term care has an work-related injury and illness incident rate that's equivalent to the contracting sectors, right? That's the horizontal. And yet the hazard score is not showing us that. And I think our interpretation is that this is an example of the way in which the application of this method poorly captures the actual working conditions in long-term care. On the other hand, there aren't a lot of those outliers. There aren't a lot of sectors that are profoundly in the wrong place in this approach. The 2 methods produce approximately the same rank ordering. Okay. So the conclusion here is that this effort to develop a hazard exposure index for industries based on occupational information, even though the source originally was expert consensus assessment and not directly measured or worker self-report, it looks like it's a valid measure of differences between economic sectors in the prevalence of hazards for work-related injury and illness. And if we were to prefer one over the other of the 2 methods, we would probably find ourselves selecting the factor analysis method. It does weight physical job demands more strongly than the simple method. You're nodding your head because you would agree.
Which would explain why the long-term care risk probably moved on that one. Yeah.
So what are the potential applications here? The Ministry of Labor has been using this hazard exposure index for the past 18 months. And it seems to have, at minimum, face validity for regulatory staff. And it doesn't replace, it just complements the kind of information that is used by the regulatory authority in, sorry, it complements the use of compensation claim information as the regulatory authority goes about its responsibilities. In terms of analytic uses, we may find that there are ways in which this kind of an index that differentiates economic sectors might be useful. If there are purposes where we would wish to adjust for sectoral differences in injury risk, where we would wish not to rely on compensation claim statistics to do that, this is an alternative for that purpose. And it may be, when we get a chance to look at this, that sectoral differences in barriers to return to work, or put another way, sectoral differences in the duration of work absences, may be related to the way in which the burden of these hazards, which are physical in nature, are distributed across occupations. And that brings me to the conclusion of the talk. Okay, good. Thanks very much. Pleasure.